You know, I should have brought a pen. Anybody have an extra pen?
Okay, you're good to go.
We're good to go.
We got paper, I just need it. Sharing. Good evening,
Thank you.
welcome to the Youth Commission meeting. Today is September 2nd and the time is 7 p.m. This meeting of the Youth Commission is now called to order. My name is Erica Zeiger and I am the chair for the Youth Commission. This open meeting of the Northborough Youth Commission is being conducted in person and remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Youth Commission are allowed and encouraged to participate either in person or remotely. The Act allows the Northborough Youth Commission to meet entirely in person and remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream or the recording of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation, unless such participation is required by law. This meeting will not feature public comment. Members, when I call your name, please respond in the affirmative. Joan?
Aye.
Judy?
Here.
Erica? Here. And Carrie?
Here.
And staff, when I call your name, please respond in the affirmative. Caitlin?
Here.
Liz? Here. Isabella? And Mariella?
Yes.
Thank you. Thank you for joining. We're gonna introduce you guys in a few minutes. So as you know, we were fortunate enough to have our youth members. So I thought that we could go around the room and just kind of give them a little bit of info about ourselves, just how long maybe we've been on the commission and our connection to the town. So Joan, do you want to go first? We'll let you go first.
Joan Clemente. I've lived in Northborough for 33 years. And I've been on the Youth Commission for 32 years. I subbed in the schools for quite a bit. And I worked at Digital for quite a while as a finance manager. And am always interested in trying to help the youth, and the youth liaisons have always been an integral part once we had youth liaisons to tell us and let us know what's going on in the town. So thank you.
Here you go. I know, sitting out of order. Liz Nolan. I am the community outreach for the Health and Human Services Department. I started last October, so almost a year. We do a lot of outreach to the community, tables at different events, as well as helping different residents with applications for assistance, like food assistance and rental assistance. So it's
I am Judy Boyle. I have lived in Northborough since 2003. I raised two kids, came through the school system, and now my daughter's here raising her family in the Northborough school system. I've been on many boards over the years, and I've been with Youth Commission just since January of this year. We're super excited to have you guys.
Erica Zeiger. I have been in Northborough since 2012. I have a senior and a sophomore, both boys, and I volunteer through all over town. I did the PTO for quite a while, and then now I'm doing this and some other some other agencies, organizations around town.
Nice to meet you all. My name is Isabella Cruz. I'm the Health and Services Director. We do everything from environmental health, so to think of your, food inspections to mental health, as well as our community health initiatives like CPR, Narcan, and infectious disease follow-up. I'm an epidemiologist by training, so I just love health data and putting it into action. So thank you for taking.
Yeah, hi y'all. I'm Caitlin Mitchell. I'm the social worker for the Health Services Department. I started back in January, so I've been in about 6 months, almost 7 by the end of this month. Yeah, so basically Liz kind of summed up what her and I do together. We kind of collaborate, helping people find resources within the community. I do some mental health programming, trying to offer some stuff with drop-in hours at the library from 3 to 5, usually on Tuesdays. So it's a busy day today. But yeah, mostly a lot of mental health programming and stuff for me, and eventually short-term counseling, or if somebody needs it now. So helping people find mental health referrals as well.
Hi, I'm Mary Ellen Degan. I am the nurse leader, wellness coordinator, and homeless liaison for the school district. I've been in Northborough for 36 years. I had 3 children who came through the school district. And I am excited to be a part as the liaison from the school, to be a part of this youth commission and to have more of a student voice. So I think it's wonderful that you can, thank you.
No, if I can mention, the most important thing is I raised 2 kids in Northborough.
When you introduce yourself, if you could say your first and last name, so that we will have it for the. Oh, I'm sorry, Carrie, I jumped over you.
No worries. Carrie Wolf, looking forward to meeting you all in person next time. I have a preschooler and we've all been in town since 2021. Yes, 4 years now. And this is my first commission in town, but generally have been a part of a lot of volunteer activities here and previously in Cambridge. And I work for a nonprofit outside of the city.
Yeah.
My
My name is Emma Persons and I'm a senior. Perfect.
My name is Arjun Ricci, and I'm a junior at Algonquin. I've been in Northborough since 2013 or 14, I kind of forget, but yeah.
My name is Allison Dennehy, and I'm a junior at Algonquin.
Well, thank you for coming and thank you for being on the committee. I gave you all folders. I just thought we could go over the folders quickly. Just to kind of give you guys some information. So the first thing is the information on Health and Human Services. I thought this was great to have. I want to quickly go over the youth liaison description. Most of this that you can read on your own. Basically acting as a liaison for the youth community by identifying and communicating the issues, interests, and events that are important to the youth, both challenges and positive developments. So if you hear of anything at school or in the community that's going well, tell us those too. We want to make sure that we're aware of that and kind of promote that as well. And then of course, any challenges or anything along those lines. One of the things that I think is super important is keeping confidentiality within this room. We do our best to not name names. We never name names. However, it is a small community. So if something does come up, which it hopefully wouldn't, we just really ask you to kind of keep that within yourselves. So that is that. And then you can put this, you can look at this as well. This is mission statement, our purpose, and the youth commission goals. So that is what I thought we could kind of just look at for a few minutes. So the meeting's from 7 to 8 on Tuesdays. it's 7 and I really shoot to finish at 8, no later than 8:15 because I know it's school and it's getting late, so we try to keep that in mind, and I think that's kind of it. Carrie, anything else? Like just from a standpoint,
No, I think I'm not sure how familiar you all are with Open Town Meeting, but our primary discussion avenue of doing anything is going to be here at these meetings so that we can ensure that we're in compliance and so that everyone in town has their ability to be understanding how our work is unfolding. So the majority of what we're doing offline is really just we need to reschedule or things along those lines rather than any core content.
thank you. True. Anything else, Joan?
No, I think that's,
That's it.
covered it, thank you.
Okay,
That's-
perfect,
that's
thank
it.
you. I have outreach events here, but I'm gonna skip down to that. When we speak with Liz, we'll do all the outreach together. We need to approve the minutes. Oh, actually, let me jump back. Recruitment's kind of exciting, so we have 3 openings and we had interviews. The select board, I believe, meets in the next couple of weeks, so all goes well, by next meeting, we'll have a full board, which is really exciting because it's been,
Yeah.
it's been a while.
It's really good.
Yeah, so that's exciting, so hopefully we'll know soon. And any questions so far? No, it's pretty simple. We have to approve the meeting minutes from June 12th. Has everyone had a chance to take a look at them?
Yeah, I said you might change.
I made them, yeah.
You sent it
Yeah.
out again, yeah.
Oh, one more thing, so, you're full-fledged members, except you're not able to vote. So if someone wants to make a motion to approve the minutes.
I will make a motion to approve, what was the actual date?
Oh, it was-
The meeting minutes from,
The meeting minutes, June 12th.
yeah.
I second.
Second, perfect. All in favor?
Aye.
So the minutes for June 12th have been approved. So one of the things that we had talked about previously was having guest speakers come in and just talk over, some various programs that we have. So we're looking at having the librarian come in and talk about different statistics and programs that she did. Can you fill us in a little bit more on the focus studies or that
Yeah,
she
of
did?
course. So the library hired a consultant to do basically like a health survey. So they did a survey as well as focus groups. So that data should be all completed and Jen will be presenting. So it's
Okay.
like adjacent to health, so we can use some of that to
Okay,
inform
perfect.
some of our.
So we're gonna try to have her October or November, what works for her schedule. Okay, perfect. And then Liz connected me with someone from, what's the name, PPAP, I know the acronym, Parents and PPAP, yeah. So she is her organization is out of Westboro, and they are a group, they're a nonprofit that provides services to families in crisis. So she has been willing to come and speak to us, and she is open on her agenda. She does certain things such as she'll meet with the family, she'll give them resources and referrals, and anything that the families may need to assist with getting themselves into a better place.
And
I don't think everybody does.
And then, yes, yeah, we're thinking, well, we were gonna see when Jen could come, cause her name is Beth, I can come whenever. So,
We also provide webinars and towards parents.
yeah, you guys actually met her
Yes.
Yeah, so we're looking at doing that. One of the things that I think we could, always use help with is getting the word out. And Liz does a great job of getting it on Facebook and Instagram, but we don't really capture the kids. So that would be something to promote this stuff, if you could kind of share it on your accounts. I don't know if you're allowed anymore to hand flyers, is that like a thing of the past? But
I can still do it.
yeah,
They're like that's
Well,
good flyers.
yeah.
You know, they're putting posters.
And any suggestions that you may have to kind of spread the word when we do things. One of our goals was to kind of capture the middle school ages, because that seems to be difficult years, but also where there's lacking, because up until 5th grade, there seems to be a lot of things for kids. And then high school is high school and there's more. So we're looking at middle school. So any ideas that you have, please let us know and we'll, work on them. So any other speakers that I know, Carrie, you had one, but I think we kind of covered it with PPAL.
I would agree. Yeah, a lot of overlap there. And I think that's it's nice to have someone who is really locally focused. Yeah.
We have also invited the town administrator, the select board, we have a liaison. And I also invited Julie Ann Hirsch, who's the chair of the select board, and they just couldn't make it today. They're actually in meetings right now.
Do we think about maybe inviting our drug-free community coordinator?
Yes, I was thinking of her, or Encompass?
Yeah.
Yeah, that would be great. I think last year, she came to Algonquin, and if you were in a certain study, she pulled you out to do focus groups. Do you remember that at all?
Like the questions, they would like pull you out of class and ask, like, give you a survey.
That's the expert,
That's
Okay, might have been that one.
yeah.
Yeah.
So a couple of years ago, we sat in different health classes and it was a focus group, so just asking everyone some questions. Last year we did independent studies, so this year we might do something slightly different, but that just allows us to gather information, more of like qualitative data to understand what you're all seeing and how we can better help. But yeah, we can ask them.
Yeah, that would be great. Emily is also, I don't know if you've seen Encompass around Algonquin. Mary Ellen, you explain it better than I do.
Encompass is our substance use prevention coalition. And we have a drug-free community grant, which is a federal grant. And Emily Flavin is our drug-free community coordinator, and it's a Northborough, Southborough group, so it's both towns. So it would be great. I mean, maybe it might be better further at the end of the year when we get some more survey data back and see what we can do. What's lacking, but it would be great to have her come.
Yeah, it would be great.
We also have a youth Encompass coalition, so she meets with them monthly, so if that's something you were interested in, but that's a lot of like planning and part of the coalitions.
Mary Ellen, do you have anything from the schools that would be worth sharing?
Right now, probably not. We're all just getting our feet back under us. But I think we have in November, we have our Metro West Adolescent Health Survey. Every other year. Every other year survey that's done. Kind of like the youth risk behavior survey done by the CDC. So this is just a Metro West, more consolidated in this area. So it's the data that's provided from our district and other surrounding districts.
And do you mind just to make sure that they understand that the resources that you provide to the school, so if there is a family in need,
Me personally?
Not like, or your group, not your, the
Yes.
nurses, you know, so this way, because I'm not sure how much.
So there are a lot of resources in the schools, as you know, you have your guidance counselor, you have there's adjustment counselors, there is your school nurses. But we also have community resources that are available that we need. We have our Health and Human Services Department in Northborough that is there to help us, and you have peers in Southborough, there's Southborough Youth and Family Services too. And we also have interface referral, which is a referral service if you need to find therapy or if you need any support in other ways. We also have Family Success Partnership, which is a licensed mental health counselors that can provide wraparound services for our families that are in need of more support than the school can provide. We also have our community organizations that support everybody, including the schools. The Rotary Club and the Junior Women's Club do Nutrition 68, which provides food for families in need, for students in need to get them through the weekend. The bags go out every Friday. Northborough Helping Hands helps with backpacks and holiday gift drives. I'm sure there's someone I'm missing, but.
So there's
The Lions Club,
There's
also
a
helps with
yeah,
classes and vision help, so we have a lot of community supports. But sometimes people don't know where the supports are, so
Yeah.
just.
and that's one thing we would, you know, we really appreciate your help kind of getting the word out. If, you know of somebody, you know, you can kind of casually mention it or just kind of be aware of it, because I don't know how much of these resources high schoolers know. And if that is something that maybe they could like middle school share it with their parents. So there is someone to go to for almost any concern that a family may have, and then that person can take it from there, so we appreciate that.
We also have the anonymous reporting,
Yes,
how to say something, which if people, you know, you can go to someone, but if you're concerned about somebody, you can report it anonymously too.
Yeah. of course.
It's always nice to tell a trusted adult, but if you don't have that relationship, you can report it anonymously.
And if, with you being in this position and you start putting it out on your social network, if someone comes to you and you think they're at risk, don't take it on yourself. Reach out to one of us and then we'll disseminate it and take it.
Yeah, exactly.
I have a question, with our youth liaisons, so what we're asking them to do. And thank you for stepping up, you're kind of the eyes and the ears for what's going on. At the high school level, we've asked you even, you know, if you here at the middle school level, whatnot. Between meetings, what is the best? And maybe I'm premature, maybe we haven't got there yet, what is the best way for these guys to kind of, you know, if they hear something, you know, we've said there's resources, but if they want to filter it through us as a committee to do it in compliance with open meeting, things like that, or do they just keep lists and will they have an agenda
So-
section?
I would, and you can, Mary Ellen, you can kind of jump in if I'm not correct. I would say, you know, if it's something urgent, you know, then I would go to your guidance counselor.
Any trusted adult.
Yeah, if it's something
For your
that,
parents.
yeah, I mean, and again, you can use the app, say something. I would say if it's something that can wait, they can do one or two things. One, you can always email me, but just send it to me. A lot of times, because of open meeting laws, we can't have too many people on an email, or you can just wait till the next meeting if it's something along those lines. But I would say for emergency, it would be the app or anyone you trust, the adult you trust. So.
Okay, thank you. And kind of to circle back for a second, as we build future agendas. Will we, like we have, you know, the HHS reports, Mary Ellen's reports. will we eventually have will we single out like a youth report, youth liaison report, like what you're hearing?
I would
You'll have an
like that.
opportunity to bring it up at the monthly meetings.
Yeah, I mean, that's a great idea. Might give you guys a few months to maybe kind of figure out your role, but I think that would be a great idea.
Or if there's something, I know a couple of you in your applications, you had mentioned you're actually starting some type of, I might be way off here, and like a youth advocacy group or something? Does that ring a bell from your applications? No. I read that. They were trying to, yeah, you were.
I think what's happening is there was another email that came out that I think it's statewide. So they asked us if we had anyone that wanted to do this statewide advocacy committee.
Okay.
And I think that's how it got out, but seeing that they weren't, they had just started, really,
Yeah.
we didn't really push it, but that is something, you didn't make that up.
Okay, yeah, there's some type of peer group or something, so, just, yeah, these guys just pretty much let them do
Let
their
them do their
thing.
thing, I mean, that's it, that's
Listen
kind of what
out,
we're doing
Keep
too.
things, and if something doesn't make sense,
Let us
to be in
know.
compliance with open meeting law, you do have a question between the meetings, just email Erica directly as our chairperson.
Yes,
And
we'll go from there.
yeah, just so they're clear on, okay, what do I do from here?
Yeah.
We're all learning as we go.
And hopefully you'll never have that urgent situation, so.
Yeah.
But yeah, that sounds
It
great.
doesn't even have to be urgent, just like, hey, we'd love to, start a peer group or whatever, just, yeah.
Or any ideas when this, any ideas on some of the surveys that go on, if we're able to change them or if we went into study. And just things like that we're curious about, because we don't know if we're not told, so. That's it. So that's what we're looking at for the fall, is to get some speakers in. Isabella, do you wanna give your update?
I'm gonna So this is the interface report from January 1st to June 30th. So during that time frame, there were 21 cases that called interface. 13 were confirmed to be connected with a provider matched through interface. 5 individuals found a therapist on their own during that process, which oftentimes can occur because they do multiple different searches for therapists. And then interface calls people 2-3 times to confirm if they'd like to continue, but if they don't answer, they can't document whether or not they matched with an interface provider. Common presenting issues, the most, as you can see, was anxiety, followed by ADD, ADHD, depression, and then other behavioral issues. The demographics of the 2021 cases that originally called were mostly ages 6 to 12 years old, followed by actually 60 plus. So that was the 3 individuals, about 14%. The rest were 13 through 50. Genders mostly female, but not by much. 8 males and then 2 individuals who reported non-binary, and then 90% of the services requested through this interface service is individual counseling. So they do match to psychiatrists and kind of psychosocial, but most of it is for individual counseling. And then how individuals learned about this service, most of them are either repeat callers, so they're calling for a different issue for themselves or a family member that counts as a repeat caller, followed by schools and then mental health professionals. And then just following up, So there's 21 cases for this time period. Last 6-month time period was 17. And then as you can see that I talked about last time, they changed their reporting dates to align with the fiscal year. So it's a little bit different. But as you can see, there was a jump in 2022 to 2023. So that is the update. Does anyone have any questions about who is using Interface?
Can you tell us a little bit about Interface?
Yeah,
People are
of
aware of what it
course.
is.
You did a little bit of it.
I know.
But Interface is a program or a referral service through William James College where towns opt in and pay for this service, where residents can call and be matched with a mental health provider based on preferences. So insurance, gender of the clinician, in-person versus remote, which is very challenging post-COVID, and a few other factors. But it's really a hand-holding line to get someone to access mental health. Any
It's
questions?
usually
about that?
quicker than if you try to do that. They find clinicians that are more available for patients.
But it's long waits, usually. Or
And is there a link to this on the town website or anything, or?
The
access
reports.
this? They go for you?
Yeah, so. this
Oh,
is-
no.
Oh, interface, yes,
Interface,
absolutely.
that's right.
So anyone who walks in our office, they're probably getting an interface card just because we're, passing the word. Any of our tables usually have a card and they're all over town hall. The schools, as we can see, refer a lot of students, and then the senior center also has cards.
I think the senior center even put it in their newsletter.
They did.
today
They did.
As well, so.
Are there any people who can't afford the co-payments and therefore come to the town service?
We have not heard of that, but they can match with Mass Health and Medicaid and
Oh, they do.
Medicare.
Okay.
Yes,
And what if they're not on Mass Health or Medicaid, they have private insurance that they can't afford co-payment?
that is a good question. I'm sure they would kind of work that out, but that is a good point. I do have, 86%, so 18 of the users reported having commercial insurance plans, and then 3 people had Medicare, Medicaid, Mass Health.
They could try to find a provider that does a sliding scale fee too as well, if they're willing to do that, but it depends on the therapists themselves, if they're willing to do the sliding scale
Yeah.
with the co-pays, but again, that's mostly up to the therapist if they market it or counsel it.
That's an enormous factor why many people do not go for counseling, because they know that the co-pays are gonna be challenging.
Is there any counseling done in town anymore?
Yeah, so
Right.
Caitlin is our licensed clinician, so she would be able to offer mental health counseling, someone.
Yeah.
Okay.
Ideally, more focused on a short term, eventually we do want people to go into a long-term counseling. With somebody on a basis but I'm here for short-term counseling. If needed, by somebody immediately, so.
So typically with Interface, someone would come into your office having a concern, say they need a therapist, and then refresh my memory, do you contact Interface or do you give them the card?
We have done both.
You've done both, okay.
Typically, it's the individual who calls themselves, but I've sat with people. I know Liz has too,
That's what I was.
to, just do the 15-minute intake with them, because that might be just one closer step to
Getting them, yeah.
Yeah, but if somebody's in a crisis moment, we want there's advocates that covers our area, they have a mobile crisis team, we actually met with them. The director of it, and then also there is the behavioral health line. So anybody in the state can use the best behavioral health line, you can call or even text. And there's always lifeline for suicide prevention with 988. So those are also other tools that we get to people in the immediate. The behavioral health line also does some connecting to counseling as well, but all the clinicians are mental health, they're licensed clinicians as well with that. They can help connect, but it's a little bit different than what Interface is giving. But then you can always keep calling the Mass Behavioral Health Line every day or a couple of hours in between versus like interface, which unfortunately won't get you any faster to getting help, but at least you're talking to a clinician constantly, or texting stuff. So a little differences on each.
This
And
is
how
why
long
we
is it
push
for?
prevention.
How long is the wait time once they connect with?
It should be 2 to 3.
So very quick, where if you're looking on your own, you're typically looking, it might
Oh, I
be
know.
months
Yeah.
or a year.
But 2 to 3 weeks is sometimes long, so.
Yeah, so that's where we kind of can step in and check in with people. Or if they need like passed on holidays, weekends, or overnight in the middle of the night. That's where all these other services come in, like the behavioral helpline. So,
And we also have a family success partnership that we contract with through the school, who can provide services in multi languages.
Okay.
6 is young.
So young.
6 is young.
but unfortunately, we're seeing
Yeah.
those numbers
I
at that
know,
age.
yeah.
Yes,
Primarily anxiety, a little
um,
bit of everything.
yeah, anxiety, or I think we are seeing a lot of the ADHD.
Yeah.
From, well, I used to work for pediatric offices as a community resource specialist, so they were seeing kids that age at 6, or even trying younger.
Sure.
So I think it's some of that transition. from
Yeah.
COVID.
Yeah, and just school starting. So prevention, we really try to get the word out
Yeah.
for different prevention programs, so families know about this service, and I mean, thank God it's there, because it's very challenging for them.
Yeah, so if there are no other questions, I'm just gonna go into key metrics for June, July, and August through the office. So we've had 14 new referrals, so 14 new clients that have come in. We've had 3 repeat referrals who their cases were closed because their goals were met and then they came back. And then most of them, or all of them, were some sort of service navigation, so looking for resources for either housing, utilities, food, legal, so many more. Through that time, we've had 3 referrals to Helping Hands, so we work closely with Helping Hands for any emergency services or aid that might help them. And then going into September, we have 10 cases that Liz and Caitlin are still working on, that will go into September.
So the first number you said was 10, so you're already at 20, is that, and we're only, because the first report was January to June and you've had 21. We're
So-
already at 20.
Interface, so the key metrics that I just reported are Liz and Caitlin's.
Oh, okay.
Okay.
So yeah, we have 14 new residents, 3 repeat, so 17 through that time frame.
And that's in 2 months over the summer, 3 months into the summer. It's a lot.
And I'm sure that will ramp up with heating applications.
Yeah.
Over the summer, we stayed busy. So I supervised a high school intern and then a NPH student from UMass Amherst, so that was a lot of fun. We all collaborated, saw some of you at the Senior Center and the Cultural Council for the Art of Wellbeing. It was a great event, intergenerational, focusing on arts and nature, so hoping to collaborate more in the future. We collaborated with Southborough Youth and Family Services and planned a rising freshman workshop, but unfortunately had to cancel it due to low participation. So hopefully we can do that again at a different time. It was two weeks before school started, so we're going on some last minute vacations. And then lastly, talking about Encompass, we hosted a youth leadership training last week and we had 15 sophomores, juniors, and seniors who participate, and it was great. We learned a lot from each other, and we had a co-facilitator from Alston Brighton that led that training. For outreach this summer, we were everywhere. We were at the Be Well event. We were at the and thank you all for helping us with the outreach. The concert series, Liz and Caitlin were at the freshman orientation, and I've already reached out to the elementary and middle school principals to kind of start that connection, and we're scheduling some.
Great.
So it is September, so it is suicide prevention month, so I'm actually gonna pass it over to Caitlin to talk about what we're planning for the month.
Okay, yeah, so did we post a video today?
Tomorrow.
Tomorrow's
That's the debut.
Tomorrow's the debut. I did a suicide prevention video just to talk about the awareness of it. We'll be posting it on Facebook and Instagram. So to our social media platforms, just to make community members aware of what to do, what it might look like. And also how to get help, with just a quick short video. I'm also doing this month, it's very important, for QPR as well. So the QPR is question, persuade, and refer. So those are the steps I'm taking on how to help somebody with suicide prevention. I'm doing this training. Unfortunately, right now it's 18 and up. Hopefully we'll do a collaborative and help how open it up to high schoolers eventually. So this is also good just to be knowledgeable for anybody of any ages to, if you hear something, to talk to them, because usually people who are suicidal really are looking for somebody to ask how they're doing and looking for a hand to help them through the dark place that they're in this at the moment. So that, and
Sorry, Tuesday, September 20th.
yes, so I'm doing that training coming up soon. Very soon.
That's
at
the
the end.
QPR.
QPR, it will be at the library.
Question, persuade, actually have the flyer. I attended last year, so, or maybe 2 years ago,
9:23?
I don't know,
Yes.
Yeah.
recently.
So
Is it 6?
it's
Sounds right.
7:30, yeah, I should have.
Yeah, 60.
I know you have your list usually. Yeah, so any adults or anybody who's 18 and up who wants to join can, it's free training. So and you'll get a booklet and you can always contact me after the training for any questions, hopefully do role playing as well within it to get people used to asking questions and how to do that. So
And then one other programming update, we're collaborating with the rec department. We got funds through the pickleball tournament recently. So we're doing a 6-week middle school girls after school program at Melican, and it's focused on building conversations, building confidence, and tools for managing stress. So Caitlin will be leading that.
yes,
and
it's called Girls United.
Are we gonna do
Yeah.
Boys United?
Well, I think we're focusing on our target, like what we received, kind of again, going back to that feedback that we've been hearing is middle school girls have been kind of needing more attention and also focus on building the group around the data. So that's kind of why we did that girls focus. And then I think we are fully registered.
Yes, we have 10.
Oh,
For the
that's
event,
exciting.
so we do have 10 total girls that will be doing that. But yeah, focusing on stress management, we have a couple of different weeks of things, empathy, communication, healthy communication, stress. Trying to think first week. Yeah, but we have a curriculum going in the next, and starting in October 2nd. I wanna say 6, but it goes through November 6th, that's why I get 6 stuck in my head. So October 2nd will be our first week doing that at the middle school.
And then I will pass to Liz to talk about upcoming outreach opportunities.
Just going back to their summer report too, we also were able to meet the veterans agent, we met with him and part of it, we're actually invited to an event at the end of September, so we have a table at that event. And we also were able to put the little postcards that you had in your folders in Northborough Helping Hands backpacks. A lot of those families are families that we help as well. That way they can know where our support and resources are. A quick outreach report for social media, since it's been 3 months since we gave you the update. Facebook now has 193 followers, so that's 62 more than we had in June. And Instagram has 79, which is 35 more. I know that doesn't sound like a huge amount, but that's what you guys are gonna come in, so we can hit 200 more. We also found out like in February that Family Youth Services, which was the department before we created the new department, had a mailing list for emails for people who wanted to receive news and announcements. And with our IT department, we were able to get the list of that and send out an email to try to transfer them over to make sure that they're receiving our news as well. So in February, that number was 35. And now it's 83, and it's probably a little bit more since I was like the last month. So we hope to gain more subscribers to our news and news. For upcoming events, again, if we're waiting to hear if we can get to the elementary schools for the open houses. We hope to have a table each of those so that we can interact with parents. There is also the Words of Wellness book club that Caitlin runs as well on Tuesdays once a month. That is, the book is Atomic Habits, which is a great book for age as well. We're also going to be at community meals at Trinity Church on the 17th. And again, Pelican will open house for that. We'll have a table at Applefest, so be sure to stop. That's on September 20th from 10 to 3. Again, the Veterans Dinner, we are also planning a bloodmobile on October 21st, which is going to be parked at the library parking lot from 12 to 6:30. So that is something that you guys can also spread to your classmates. I know there's a group that does one in this at your school as well, but we're hoping to get all ages in to fill all the slots. I forgot how many slots they gave us, I'd say it's like 50. We also work with the churches in the group and as part of our community partners. And Nativity Church is actually gonna have a grief group that they're starting, so we'll be putting some information out with that. It's gonna be a 6-week type group run by their pastor. And that sign up should be up probably the end of this week or next week, so it's kind of a big area to cover for something. Other things, we have the Narcan training, which is September 23rd, and a CPR training, which is on September 10th, and a flu shot. Did we mention that or?
Lots more about flu shots. We'll be posting.
Okay.
Still a whole other meeting.
So the Health and Human Services Instagram, I can, if that's just, that would probably be the best way to get information. For them to forward it.
You guys, yeah, but I'm guessing you're not on Facebook, so Instagram, yeah, and Northborough HHS is like the. So we try to post daily something, and especially this month is suicide prevention month, so it's a good message to share.
And it's also recovery awareness month as well, so Encompass and HHS will.
Right, Encompass has their own social media.
You know what I can do?
I'll share.
Yeah, I will also, but when I remember, I'll send an email with some of the socials that will be helpful for you to like, and then you can do what you gotta do.
Have 3 more followers.
I was thinking that, I was like, 197.
So I had not been following you on Instagram, so I just did.
Oh, yeah.
And when I followed you, up comes Encompass Coalition, Gonk Connects, Gonk 8, oh, that's Career Connections. You know how they put all these
The suggestions.
okay, alright. You know, you can follow.
Is Gonk Connect like the main?
I don't follow you on
No.
Facebook.
That's Gonk brand,
Yeah.
okay.
And he's also the teacher that runs the golf brand is actually on the school
Oh, nice.
as the media sector rep, so we're gonna try to get in there too.
Yeah.
Do you know what teacher that is?
John Cahill.
Okay, of
Yeah.
course. So any of these outreach events, again, we like to spread the word, but as Liz mentioned, if you wanna pop over to Applefest or anything like that, we definitely welcome it. Liz, do you need any of us for Applefest? I never sent that out because I knew we were meeting. Or are you covered?
So,
You know,
I think, I know, I thought you said 12 to 1, but I think
either way.
we're covered in anyway, and we're sharing a booth with Northborough Helping Hands, so. some of us can do double duty.
Okay.
Yeah, I'll be there in the morning.
Okay, so,
I'm
yeah.
gonna be setting up.
Okay.
And I'll be towards the end. But I'll be also home.
And for the open houses, we've all got our assignments.
Yes, so we'll just confirm once we know for sure that we are able to have a table.
Okay,
Which
perfect.
hopefully will be.
So you remember elementary school, when they do their open houses, we'll have a table there that just shows some of the information. And you're always welcome at some of these tables to come and set up with us or just hang out.
It's fun.
It's, in the end, it's fun, you'll see people, you know, but typically 20 to 30, so it's not a huge commitment. No, it's,
Our website also has a lot of information. If you go to the town main website and click on departments and come to Health and Human Services, you can see everything the department does and get a little more information. If you want to just.
Let's put out an awesome newsletter.
Yes, and I'm just waiting for one thing before I print, otherwise I don't have it.
I'll include that in the email so you can go on and you'll get that.
You can also sign up too. So you can get it. right to
Bring
your
more
email.
people on this.
Yeah.
And it's all about the numbers.
And I
Get
think
your families and friends to sign up.
in general, we want this to be beneficial for you as well. So if you're interested in public health at all or want to meet with any of the staff one-on-one or shadow, like, please let us know. We're more than happy to.
If you have great ideas of things you wanna see in town.
Let us know.
Let us
Yeah,
know.
let us know.
We're able to do volunteer hours. So if that's something that you're gonna need, you can just reach out and we can write up a description, we can, you know, give you the hours and sign off on them. So there's a lot of different things. I know, I'm sure you're gonna be filling out applications soon. So we can, you know, if you need a better like description of this for anything or the scholarships, just let us know.
Cause for us at Health and Human Services, like we are relying on hearing back from the community for programming. Cause we wanna put out stuff out there that is gonna be beneficial to the community, like Girls United, that was something in need. And so we put it out and hopefully we'll get the good feedback back from that in the next couple of weeks, but once we get started. But yeah, we're really looking to hear your voices, cause we really don't know what's out there unless if somebody says something to us. And we can make all these great programming ideas, but we want people to have a buy-in as well into it.
Yeah, and not just, you know, if you hear your parents needing something too, that goes along with our programming as well.
Carrie, did you have anything that you can think of?
No, no, this is a very thorough list. Sounds like you all were not busy all summer. Thank you.
Can I just mention something that went really well in the past? I don't know if they allow dances anymore, I don't know if they stopped them in the high school, but we ran them in the middle school. And it was a lot of fun for us who ran them, and also the kids seemed to have fun. Sometimes they think the kids, especially in the middle school, need to have fun and have fun. Would that be something you would consider, again, picking up?
I think that would be a collaboration with the schools and
Oh,
They do have some middle school
Like fun
activities, some of fun nights, they're not dances,
yeah, these
you know, they call them fun nights.
Oh, they
So
do.
they have activities for them, it's not just music and dancing, there's
Oh,
different
that's even better.
activities.
Okay.
Yes, so they do have those for each grade usually. I think at different times throughout the year.
And is that at nighttime?
Yes, and.
Oh, that's good.
Did you go to them when you were in middle school?
Yeah, I know we're going to one.
You were.
We
Yeah.
had the 8th grade one.
Yeah, the 8th grade.
That's all I remember.
Yeah.
Did you enjoy it?
Kinda.
Yes.
Good.
Yeah.
And how are you feeling now after hearing all this? Are you feeling that a little overwhelmed or you know, not where, you don't know where you wanna focus your attention?
think it's just, I didn't know so much of this existed.
Yeah.
So, like, this is the first time hearing of a lot of this, so I think just getting it out, just the kids our age.
Yeah.
Will be the first thing.
Yeah, that's great. That's what we're hoping.
Yeah.
Anything else that worked well in the past? With the
I
liaisons?
I was trying, we did some programmings that were, and I'm trying to remember, some were in the summer. Because a lot of people, you know, there was a daycare problem. And it had to do with, we taking some kids this, I don't know if it's gonna happen now, to the beach. Yeah. Yeah. And
We're all like,
No, thank you.
yeah, that.
We let the rec department, do that.
Yeah.
That's their,
And
Butter.
yes, that's not,
and I do believe some arts and crafts, especially for the middle school, which, and I do this with my son, so we'll be in eighth grade, but, arts and crafts, you know, sometimes you say, yeah, no, I don't want it, kind of too babyish, but it can really relieve stress. And.
I forgot to mention I'm an expressive art therapy undergrad major, so
Yeah,
that's a background of me as well. Yeah.
so that
Yeah.
was great, we did some programs like that, and like, when the, books first came out, the coloring book, you know, the adult coloring books. So those things were really well programmed.
Yeah,
I'm excited to see how the 6-week girls group goes.
yeah.
Hope it goes
I'm glad you got 10 people to sign up.
Quickly too, like.
Yeah.
There's,
I bet at the start of the school year, there's lots of stress.
Yeah.
there's a wait list.
down there and so.
Oh, wow.
The second session, right?
Well, we hope that this one goes very well to have a second session in the spring. That's the ideal goal. So.
So, and I would love to see something that Joan said with boys, as a mom of 2 boys, I know they could use it as well. But, does anyone have anything else?
I was just extending on the topic of art therapy and arts and crafts. I know in town, we also have a cultural council. And the cultural council we're all kind of working together. There's a lot of crossover and collaboration between the different departments and commissions. So you know, there's they have some things planned, some projects that are gonna be happening downtown and things like that. So I know, click on Instagram, follow up, go on the website, follow all the different departments, and I'm so sorry that I didn't follow HHS until this now.
I don't even know what ads you're gonna get.
But
Maybe it's just
really, you guys know social media, hey, click it and share it and get it. But yeah, so there's a lot of really, really exciting things that are already happening, planned to happen, and it's only gonna get better. So you guys help us spread the word.
Really, it would be better with your voice to let us know what's needed.
And then I'll just end with, again, Encompass, we're hosting our annual retreat on Tuesday, September 16th. So it's really an interactive session where we think through data. We actually have a consultant coming to talk about our parent survey data that was done last year, and really thinking about root causes of substance use. So if you're interested in attending, feel free to let me know. But that is September 16th in the evening. Youth and leaders.
I'm gonna be going to, so if anyone wants to sit near me, you're welcome to.
We'll all be there. We're in different hats.
Yeah, so, I'm sorry, what was that? September 16th.
And what is
It's the Encompass Coalition annual retreat. So it's where we think about our strategic plan for the DSC grant.
They're the youth coalition, the youth group too, and they've done a lot of things. So excited to hear their voices too.
Well, what a nice job and really good job pulling in all the different organizations and schools and working together. That can be a real challenge. So thank you, John.
So, does anyone have anything else?
Thank you for coming.
Yeah, just one thing in our sort of brainstorming space. It's part question, I think maybe best for Isabella, and you may not know off the top of your head, but one thing I was thinking about for, we had kind of toyed with this as one of our ideas maybe 4 or 5 months ago. We talked about like essentially like childcare at town meeting, and then we kind of moved on. I've looked at the list of boards and councils in towns, the different commissions and whatnot, and I don't know enough, but it doesn't seem like supporting overall civic engagement is the focus of any one board or council. By default, I would assume town moderator and select board have like the majority of that responsibility, but really was just kind of like mulling over this piece again around with our focus on youth and connecting families in. I love how much we talk about all the different programs and getting people familiar with these programs, getting the youth familiar with these programs that HHS is running, but it does feel like something I'm just mulling over is there a role for us in this part of our outreach and our being liaisons into the community as part of it, just like overall engagement into running our own community. And so I'm happy to leave it at food for thought for now, but I really just I couldn't get enough of a sense of if anyone is already looking at how do we get more people to town meeting and to make it something that's available or other opportunities along those lines. And that might be more pertinent than I thought, because I think we're having a special town meeting most likely in not that long now.
Yeah.
I think we can always tap into the honor societies at the high school, but that's what we've done when we were planning it for special town meetings in Southborough in the past, so to provide childcare, but it's a big undertaking.
Yeah, I'm sure.
Sorry, we have, does anybody know what LCAP is? We have meetings at the school, it's like, I think it's like it's like a meeting for parents who maybe don't speak English as their first language.
Yeah.
And we have childcare at those meetings, and me and a lot of my friends do it, so maybe if we could go there as well, if we needed childcare at the meetings. I don't know if we need like certifications or anything, but there's people who are willing to volunteer, I think.
Yeah, I think at one of our recent Encompass events, we had childcare that a few parents took us up on, so that was helpful. So Carrie, I think civic engagement is important in all of the committees, and I think it does have a place in ours, but I definitely, to your specific, I can talk to Steph, our town administrator as well.
Thank you. Yeah, totally fine.
You know, so your timing here is really good, Carrie, because I know that, you know, this past year when we had to go to 4 nights. Yeah, so my understanding is the town collectively is looking at, you know, at this, so obviously getting more attendance here. How do you get 4 nights into 1, maybe 2, things like that, so part of the conversation, and childcare is always a big problem,
Yeah.
to get people to town meeting, yeah. So
Thank you.
Yeah.
Bring it up, yeah. So
Yeah.
if that is it, does someone want to make a motion to
Just
adjourn?
confirm, sorry, that October 7th.
Oh, I'm so sorry. October 7th still works, yes, and now November 4th is election day. I don't think we need to reschedule, or
I just noticed it on my calendar,
Yeah,
so I was like,
I mean,
did
we vote for, I don't think anything really this time, so I think November 4th will work.
Yeah,
If anyone doesn't have any.
I will not be here, but I will send.
Okay, yeah. Yeah, so, and then December 2nd, but we will confirm October 7th at 7 PM. And we should be here. If we're not, we'll let you know. There's gonna be another location.
Motion to adjourn.
Second. We, everyone in favor? Aye. And we have adjourned at 8:05. Carrie, good luck. Tomorrow, is it tomorrow?
This morning.
This morning, how'd it go? Oh, yeah, well, it's gonna happen. Well, good luck.
Yeah. It went about as well as expected, but yeah, I all the extra minutes to not be driving to and from are warranted so that I can,
Yeah.
support my gal. Yeah. Yeah, it'll be good in the end, but yeah. Preschool is always a rough transition to start.
Yes, it is. So,
Yeah.
thank you. Bye.
Thank you all. Have a good night.
Bye.
Bye.